Відкриваємо.
We resume our work and speak on the topic Ukrainian Catholic University opens Rehabilitation Medicine School. And we have Uliana Suprun, Director of the Medical Rehabilitation School, Ukrainian Catholic University, and Natalia Klymovska, Vice President for Development and Communications from Ukrainian Catholic University. I'm pleased to invite you here, dear ladies. Good afternoon. I'm Natalia Klymovska. I'm Vice President for Development and Communications of Ukrainian Catholic University. I'm here today to present new program of the Ukrainian Catholic University. Rehabilitation Medicine School. Looking at the possible development ways for our programs and having analyzed the situation in Ukraine, we found out that our medical sphere requires a lot of attention. Of course, there is a lot to be done, but we have to start with something. In our university, we have the bioethics program, this medical psychology and psychological health program, and now we decided that we would like to go more deeply in this sphere. And we were thinking about two programs, rehabilitation program and public health development program. Why do we think that it is needed to Ukraine? The life expectancy in Ukraine is 11 years lower than with our closest neighbors. Like in Poland, for example, they have similar climate conditions, but the life expectancy is 11 years higher. In Ukraine, we have stress, poor nutrition, but the quality of medical services is also important, and we started to look for proper partners for our programs, and we looked for very inspired people, and we are happy to come across with Madam Uliana Suprun, who came from America, but she is with Ukrainian roots. She got her medical and education in the United States. She assisted much in tactical medicine, and she assisted much in Maidan. And Uliana also is very keen to this idea of rehabilitation development in Ukraine. So now I'm happy to invite Uliana to the microphone. Thank you. I wanted to say a couple of words about the Rehabilitation Medicine School. In the West, there is different perception of the rehabilitation. The patients which undergo rehabilitation, they have the same rights and the same needs as other people. In Ukraine, rehabilitation is organized differently, and Mainly this happens in sanatoria, in spa resorts, but the system of rehabilitation, the rehabilitation system is absent. But the process, which usually starts with pre-operational training and ends with full rehabilitation, is absent. Here we have one cyber serviceman who participated in defense of Donetsk airport, and he lost both arms, and the rehabilitation suggests that the person should be restored to be enough to be integrated into the society fully. These are pictures of our Ukrainian rehabilitation centers. These are like spa resorts or sanatoria, but there are no ramps, and people can have no access to the premises. Instead of this, we need new rehabilitation centers and new rehabilitation system. Why do we need to build up rehabilitation system? The military conflict and the war in the East have raised the demand for rehabilitation services in Ukraine, not just for the servicemen who require rehabilitation, but those patients who are IDPs from the East. Because IDPs are now relocated to central and western Ukraine, and many rehabilitation centers existing in the east are not now available, and Crimean rehabilitation centers are not available anymore. There is a very limited number of rehabilitation centers sufficiently equipped and staffed to provide assistance based on international and Western centers. Here on this map you see where they are located, and you can also see that they're insufficient for the numbers of people which require this rehabilitation. This is almost 1 million of people every year. The comprehensive approach to high quality rehabilitation comprises several aspects: psychological rehabilitation, physical therapy, ergotherapy, and services of the doctors, surgeons, adaptation to normal family life. In the Western system, a patient is in the focus of attention. The program, the rehabilitation program, is focused on the patient, and these programs are tailor-made for the patients. That serviceman who lost both arms has different or should have different focus than those who lost one leg or were psychologically wounded. That is, we need to implement new state programs of new state academic programs in ergotherapy and physiotherapy, and we should also build up new rehabilitation centers based on Western standards. Ukrainian Catholic University is one of the leaders of education in Ukraine. Quite often we introduce new advanced programs and in building up new areas, new sectors. I'm not sure whether many of you visited Ukrainian Catholic University in Lviv, but There is a good building. They have a very good campus. It is well equipped, and communication between the faculty and the students is very open and sincere. Professional education is one of the foundations for success of rehabilitation. In Ukrainian Catholic University, UCU can be the leader in it. We have chosen master programs. Now there are new professions and new state codes of professions are drafted by the Ministry of Education, and these both programs should be presented at the master's level. Those who graduate from bachelor programs should be allowed to attend master's programs and on these medical specialties, and then have training, additional practical training in rehabilitation centers. Our program is called the 2020 strategy. We have been developing medical, psychological, and social support program, rehabilitation program, and healthcare program. The physicians program will be organized at the national level. During first several years, we will invite foreign professors. Also, we'll invite Ukrainian professors to attend Western universities and gain international experience. This will be a 2-year program with internship in rehabilitation center.
Concept of Center of Rehabilitation Excellence. Services for patients and to be kind of training centers for our students. These services will be provided not just for militaries but to civilians as well. Those who will come into this center of rehabilitation, now we think that it will be ambulatory center, not hospital. They will have some therapies. There will be some premises if they are not from Lviv, but if they are from Lviv or nearby, they will go home at night. This kind of system exists all over the world. So very often the rehabilitation doesn't need patients to be in hospital for months. So that in this way they will adapt to the normal life as soon as possible in their family, in their houses. Rehabilitation is going on together with the crew of specialists. There are doctors dealing with rehabilitation, there are physiotherapists, ergotherapists, psychologists, sociologists. There will be a whole crew who will plan rehabilitation of the patient based on the needs of the patient and these things that patient wants to obtain depending on his goal. Depending on what did he do before rehabilitation and what he wants to do after rehabilitation. Center of Rehabilitation Excellence starts from conference in Ukrainian Catholic University on November 4th to 6th. We will present it. Also, we will present new school of rehabilitation medicine, and also there will be discussion about standards of training, of practice in Ukraine. today's standards, today Western standards, and how we can join it to make unique Ukrainian system. Also, we will discuss the difficulties of disabled people in Ukraine, not just in the houses, but also we will discuss their rights. And we finish our conference with the presentation of new rehabilitation school of Ukrainian Catholic University. Then we will be looking for the specialists who will write academic programs. There will be directors or manager of academic programs, and also we are looking for director or manager of rehabilitation center. We have premises already for rehabilitation center. It's in Lviv, 800 square meters in one premises and 200 square meters in other building. We will plan our renovation first, because we want to have wide corridors according to the standards of such centers. And also we want to have rooms and services required by our patients. That is the plan of the building of rehabilitation center. On Specifichna Street there is a building already. We are very grateful that church gave this building for our needs to start building our center. And we are looking for funding, potential partners. Our potential partners are NATO that have trust funds now for rehabilitation purposes. Also, there is United States European Command that is a sponsor of our conference. World Congress of Ukrainians that joins diasporas, and the next ones. Our future sponsors. Other partners are academic programs, academic partners. Association of Catholic Colleges and University is where our university is a member. Also, we have good connections with other Catholic universities that help us to develop our programs. Also, we have connection with the best program of physiotherapy in Canada, in Queen's University, also in Yale University. These are connection with people who deal with psychological rehabilitation, and University of Wisconsin Madison. We also have few acquaintance doctors there, rehabilitators, who will cooperate with us. Next slide. Also, we are looking for partners to base our rehabilitation center as a sample. We are looking for these kind of partners in Eastern Europe because they're similar to our system. We mean Poland, Estonia, Latvia, Romania, Bulgaria. And also we will send our tutors and first physiotherapists and ergotherapists who will work in center to have practice in these rehabilitation centers, to give them possibility to get some experience and return to Ukraine. And as usual, we have preliminary budget, and partially it's for academic programs and partially for the renovation of rehabilitation center. Ukraine needs new contemporary rehabilitation system to give the best possibility to veterans of ATO and civilians. On the right side, we can see the same cyborg guy who was injured in Donetsk airport, and that's how his hand looks like. That was made in Ukraine. It's functional, it works, but he couldn't have that one that we can see on the left side because it's biometric. When you because you can move fingers with that left one. And with this kind of hand, he could return to the same life he had before he was injured. Thank you. Thank you very much for your presentation, Mrs. Uliana, and I have few questions to you about idea. I think it's a great idea. That's exactly what Ukraine needs at the moment. Will open this program as upgrade qualification course for doctors who have experience in rehabilitation already. As far as I understand, you are planning it just for the students, or this program will be opened for the people with big experience? Thank you for your question. This program is a training for physio and ergotherapeutic. There are medical specialty, but not specialties that cure. And Ukraine, there are a lot of doctors who are dealing with rehabilitation, and there are a lot of specialists who are not specialists in some ergo physiotherapeutic education. They are doing that already, but their profession is not recognized. So the first step for us to recognize these professions, to have them in the classifier of the jobs in the Ministry of Social Politics. And based on that, we will prepare new physio and ergotherapists. But those who are working already, they could be licensed as physio or ergotherapists, but they would need to show their certification or to pass a test. In our rehabilitation center, we will require from our employees, if they are not the doctors, few months of practice in rehabilitation centers in Poland or Estonia or United States of America or Canada, to get the experience of standards, how it happens on the West. So we don't want to involve people who are busy with it already because they're doing a good job already. First of all, we want to give first-class standards and recognition of specific professions that don't exist in Ukraine at the moment. And second, to start new training programs. And those who are working already, they will keep working on their positions. But we will have a new wave of other physio and ergotherapists. How many people are you planning to hire for the first stage of the program? There will be about 50 people on every faculty, but we are planning, but it depends a lot on the capacities of rehabilitation center, for how many patients it will be calculated. Now we look at this premise. Now we are planning how many patients we can take at the moment. Thank you. If there are no any other questions, let's finish. Thank you very much and wish you any luck with your program in Ukrainian Catholic University. Thank you very much. We are finishing the working day of Ukraine Crisis Media Center, and the schedule for tomorrow will be on our site till the end of the day. Bye-bye.